that burning feeling that quietly builds with every step. Foot pain rarely arrives loudly. It settles in slowly, changes how walking feels, and before long, even short distances start to feel heavy. Today, we are talking about the most common causes of heel and foot pain, why they happen, and what the body is really trying to say when the feet begin to hurt. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Let's start at the heel, because this is where pain often feels the strongest. The plantar fascia is a thick band of tissue that runs along the bottom of the foot, connecting the heel to the toes. When this tissue becomes irritated and inflamed, pain shows up under the heel, especially after rest. Morning steps can feel like walking on a sharp edge. After moving around for a while, the pain may soften, only to return again later in the day. Another source of heel pain comes from the back of the ankle. The Achilles tendon connects the calf muscle to the heel bone. When this tendon becomes inflamed, the pain sits behind the ankle and spreads down into the heel. Climbing stairs, walking uphill, or standing on tiptoes can feel uncomfortable and tight. Sometimes the Achilles tendon can tear suddenly. This causes sharp pain, swelling, and difficulty walking. This type of pain appears suddenly and needs urgent medical attention. Now let's move forward to the ball of the foot. Pain here often feels like stepping on a pebble or a burning pressure under the toes. This can happen due to a small fracture in a metatarsal bone, often linked to overuse or repeated impact. Inflammation around the heads of these bones can also cause aching and tenderness during walking. Another cause is Morton's neuroma. This involves irritation of a nerve between the metatarsal bones. The pain may feel sharp, electric, or like something is bunched inside the shoe. Tight footwear often makes this worse. Foot shape also plays a role. Flat feet can place extra strain across many parts of the foot. Pain may appear in the heel, arch, ankle, or even the knee. Some people with flat feet feel no discomfort at all, while others develop pain gradually over time. In children and early teenagers, heel pain can have a different cause. Sever's disease is an inflammation of the growth plate in the heel. It often appears during growth spurts and feels worse after running or jumping. Rest and gentle care usually help as the body grows. Foot pain is not always limited to the foot itself. Joint conditions such as osteoarthritis, rheumatoid arthritis, or psoriatic arthritis can cause stiffness, swelling, and pain in the feet. Gout often causes sudden, intense pain in the big toe, along with redness and warmth. Bunions cause a slow, gradual ache near the base of the big toe as the joint shifts out of position. Nerve problems can also send pain into the feet. Peripheral neuropathy may cause burning, tingling, or numbness. Sciatica can send pain shooting down into the foot. Tarsal tunnel syndrome creates pain and pins and needles along the sole. Blood flow problems, often linked to diabetes or peripheral arterial disease, can cause aching, coldness, or slow healing in the feet. Now let's talk about plantar fasciitis in a little more detail. Doctors usually diagnose it by listening carefully and examining the foot. Tests are rarely needed unless the picture is unclear. An ultrasound scan may show thickening and swelling of the plantar fascia. Healing takes time. Plantar fasciitis often improves over several months, sometimes taking up to a year. This tissue heals slowly, much like ligaments. The good news is that gentle care makes a real difference. Rest is important. Running, long walks, and standing for long periods should be reduced for a while. Barefoot walking on hard floor should be avoided. Footwear matters more than most people realize. Shoes with soft cushioning and good arch support help absorb shock. Old, worn-out shoes often worsen the pain. Heel pads and arch supports can reduce pressure on the sore area. These should be worn in both shoes, even if pain is felt on a single side. Pain relief may include simple painkillers or anti-inflammatory medicines. Ice packs applied for short periods can calm soreness after activity. Stretching is one of the most effective tools. Tight calf muscles pull on the heel and keep the plantar fascia under tension. Gentle stretches done daily help loosen this chain of strain. Rolling the foot over a firm object can also bring relief. When pain does not improve, other treatments may be discussed. Steroid injections can reduce inflammation, but are used carefully due to possible risks. Shockwave therapy uses sound waves to stimulate healing, though results vary. Splints worn during sleep keep the tissue gently stretched overnight. Surgery is rarely needed and is reserved for stubborn cases that do not improve after many months. The outlook is encouraging. Most people recover fully with time, patience, and consistent care. Prevention is just as important. Supportive shoes, regular stretching, weight management, and avoiding hard surfaces all protect the feet from strain. Foot pain is not weakness. It is the body asking for balance, support, and time to heal. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, Medicine Specialist, Diabetes and Hormone Specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.